give us the key points of your message about those guidance that will be made available for the ESCAP audience?
Well, I think the main point is the importance of autism spectrum disorders. We know that they are much more frequent than we thought. They affect millions of people in Europe and their families. So it's very important to produce guidelines, orientation as to how to support them, how to help them to have a good quality of life. And that's the whole point. The point is to apply personalized treatment support to these people.
What should we think about in terms of diagnosis first?
In terms of diagnosis, the whole guidance is being directed towards areas in Europe that do not have services, basically. So we explain what are the essential criteria to make diagnosis, what are the most simple and easy instruments to detect as soon as possible, because we know that it makes a difference to start soon. Then how to educate them, how to support the educational system, and how to help them to go to adulthood. Adulthood is a very underdeprived area for these families, for these people, for these citizens. So I think in the future there's going to be tremendous effort to support across the life cycle. And I think we all got to be involved, not only the doctors, the medical care, but education departments, the social services and social care, the labor department, the living units, everybody. This is a community problem, and it must be a community solution for it.
What about treatment? Some key points about your recommendation about treatment.
The treatment first is personal. There are no two single persons equal with autism spectrum disorders. So their basic orientation and the basic guideline is right now is the education. Education fostering skills and fostering empowerment so they can represent themselves and represent their children to access the services. Also, we have a pending task for research in new medications that can support these people. But for the time being, is community work and education. Those are the two essential issues, and that can be done in any country of Europe. That there are remote areas and underserved areas in every rich or poor country in Europe. It's not true that there are good countries and bad countries. There are good areas, good regions and bad regions in every country. And we have to support these people, probably providing also teaching, providing new technological approaches to them, to use them, and using also the family societies that extend this widespread across Europe. But I think we have to be aware that we are not practicing in the university. We practice in real life, and these people have real lives.
Can you tell us something about those individuals who have some symptoms that are close to diagnostic but not necessarily reach all the criteria? What should we think about these?
We use a manual for diagnosis, the DSM-5 or the ICD-10, and we can say that our patients do not read the manual. They don't come to us with all the symptoms. If a person has a difficulty, even if it does not constitute enough to be classified as a formal diagnosis, if we can tackle that difficulty, if we can support that difficulty, we should do it. So we should overcome, we should not be restricted by the diagnosis. If a person has a diagnosis, fine, we'll support it. If the person does not have the full diagnosis, fine, we'll support him or her as well. The women with autism have been in the shadow so far. They have different conditions, so to speak. They are more social, and they understand better, but they cannot mix well. So what they do, the majority of them do, is what they camouflage their symptoms. They try to interact by camouflaging the difficulties, and that generates a lot of suffering among them.
And how would that translate into clinic, in the clinical differences between men and women with autism?
Well, it means that in clinical sense we might oversee diagnosis of girls if we are only looking at the male profile and saying, well, this is typical. I'm sorry, this is not typical. We are different, and men and women are different. Also, in the autism spectrum diagnosis and condition, the last message is that these people have an awful premature death. And we had no idea about that. They die as an average 16 years before the people of the same age and condition and socioeconomic status. So it is the responsibility of all of us to keep them well and to keep them alive.
Do we have some ideas of the factors that lead to this premature death so that we can also understand how to be more prepared to follow?
We do. For those that are more disabled, those that have the most severe neurological problems, epilepsy is the main issue. For the typical middle-aged person with autism, the problems are the same that you and I have. Autism also relates with hypertension, obesity, lack of exercise, all kinds of things. But they do not go to the doctors. The medical services do not accept them and do not explain to them what to do. They don't reach them. And then, very sad, for the most able ones, they kill themselves. They die of suicide. So that tells you how sad is our lives and how responsible we are for bringing mental health and health to them.